Deb Cooper with the Canine Chronicle, bringing you Table Talk live from Zoom. I'm here with Jim Moses, who will be heading out to Oklahoma in a couple of days to judge our first dog show back. So Jim, first of all, it's so good to see you. I miss my people so much. Even seeing your face makes it better.
We're all in the same boat.
We are indeed. So as you plan to go to Oklahoma, what is the first thing that crosses your mind as you're heading out?
Well, I'd already given it some thought previously as how would I run my ring as a judge during these difficult times. And I intend to use what I consider common sense. As far as, the only time I expect people to keep their mask on is just during the individual examination.
Mm-hmm.
But anyone that's ever shown it to me knows that that's very brief on my part. Other than testicles and teeth on short-coated breeds, I find no reason to touch dogs. For sure, some of the coated breeds, you do have a couple of places that you do need to touch with your hands. And that's the only time that I really feel that I could cause a problem to an exhibitor or they could cause one to me.
Okay.
I certainly don't expect them to keep a mask on when they're dating. Shit, I can hardly breathe all day with a mask on when I go out grocery shopping.
I know.
If somebody told me to run a dog with a mask on, I'd hand them the dog. They could do it. I'll pick it up on the way back. But, I've been in favor of getting out and getting back to work all along. But that doesn't mean I'm not going to use common sense. I do it now. I keep hand sanitizer in the vehicles. Even when I get gas or go into a convenience store, I have hand sanitizer. I use it after I handle a gas tank. My hands are biggish, so it's a pain in the butt for me to find big enough gloves to wear. So I have very good hand sanitizer. Carmen Batalia's son is involved in a company that makes some of the best out there. So, I have access to it and I use it. I think also that, to be truthful, the first few times I used a mask in public, I was kind of, I hate to say it, but a little bit embarrassed, like I was a little wussy, But once I thought about it a bit, that's exactly how you show respect to other people, because it's not great to stop you from getting it if it's, in the air. But if I were to cough and was a carrier and didn't know it, it's a really, to me, not to wear a mask in public where you're really close to people. That's almost to me like showing them great disrespect.
Mm-hmm.
Whether you think you need it for your own protection is not the issue. And I also think that'll help people overcome the fear of, I have friends that have not been out of their house in 3 months.
I do.
If they get mail, they spray it, like wait 2 days for it to dry. And I can't, and this is something we're finding new information every week, and the same health authorities change their mind every 2 weeks. Everyone wants to put blame or tell you should do this or shouldn't do that. Nobody has the answers, but I can tell you, I guarantee you, if we don't get moving and get things back to as near normal as possible, we're going to have a lot of other more serious. Look at the people needing cancer treatment that have advanced stages that went way worse because none of them had a chance to even get treatment.
Mm-hmm.
That's asinine.
Mm-hmm. Mm-hmm. People are afraid. I know. And you try to hopefully translate that fear into, doing things that you can do.
And I understand if you have underlying conditions that make you at high risk, then please, for everyone's sakes, stay home, wait till we get a vaccine. But, it just reminds me some of the real more outspoken people in our dog show community that want to embarrass and criticize people for wanting to go.
Yeah.
You know, that's not right either. I
No.
mean,
You do you, I'll do
yeah,
me. You
right.
know, I mean, and
Sometimes
it's so true.
the
I mean,
great people that are in a better age group, uh, you know, have a different outlook on this because it is changing all the time. I mean, we have so many more things, even if you do contract it, to help you get through it now than we had 3 months ago.
right,
So, I mean, you know, it's,
right.
you have to be fair-minded and if, you
Mhm.
know, but as I said, I think it, in my own opinion, unless you have a medical reason why you can't wear a mask, I think we need to, when appropriate, to show respect for other people that you also care about them.
Absolutely.
But you know, I use common sense, and the problem is even with the AKC wishing we would let exhibitors show their mouth. Well, you know, in about 3 seconds, if this person can do it or not do it,
Right.
and you know, being a handler my whole life, I can get it done in about 1.5 seconds.
Mhm.
And I have a tendency to help people if they're having a problem because, and some of them, if they're inexperienced, they sometimes hurt the dog's mouth. I
Right,
mean, if you really pay attention to how a lot of these movies show a mouth, I wouldn't want someone looking in my mouth like that.
right. Absolutely.
So you give them a little education at the same time, but
Help them out.
that's the only time with, you know, or table breed. But I examine on the table and I judge every dog on the ground because you and I both know some dogs, the minute anyone, including their owner, touches them,
Yep,
they'll either stiffen up or they'll squat.
yep.
Either one gives you a fictitious look at that dog or what you think it is.
Uh-huh. Exactly.
You
Exactly.
know, a quarter of an inch squat in the pelvis changes the whole rear angulation tremendously.
Right. So if you were to give your fellow fanciers one piece of advice as they head out to the first dog show, what would it be?
Uh, Probably to not gather in big groups, and if you do, stay a couple feet apart and use a mask. Then it's kind of funny because we all have a tendency to hug and kiss people that we're
I
crazy about, you know.
touchy feely people,
Yeah,
aren't we? We just
we're a
don't.
touchy community. Maybe for a while, at least until we get more of a prophylactic for this drug, this disease, and a good vaccination. We may have to just chin up and touch elbows and not be just hugging the crap out of each other, even though you want to. It's and
Right.
I know it's embarrassing,
It's
but
hard.
yeah.
It's really
Well, especially with guys, you know, and the younger ones, they don't want to seem like wussies. But you know, but by refraining from how we act naturally, I just think makes more of a man of you. You because you
right.
know, obviously, if you're young enough, your risk is so much less than guys in my age bracket.
Mhm.
I mean, I smoke 2 packs of cigarettes a day, and I have since I was 14.
Wow.
I'm
Wow.
74, so if I get it,
Hmm.
uh,
Hmm.
I'll be making a will out real quick.
Right. So you're my husband's age, and the reason that I'm not coming is because he's in a more vulnerable category due to some, illnesses that he's had over the years. And, I asked Carol, you know, who is kind of like my um, person,
Mhm.
what should I do? And she said, you've got to think about if you can live with all of the circumstances that could come up if you go.
Well,
And if you can, go.
I have a good answer for you. You go. When you come back, your old man lives in the attic. You live in the basement. Wear a
and,
face
and
mask.
the world will be a better place, right?
You won't be fighting with each other. You know, get a dolly to send his nightcaps up there, and
Right.
but it's
Everybody will be happy.
there's
No
ways to
kidding.
manage. Yeah.
Yep. All right. And if there was a big don't, I mean, you've said don't gather in groups. So, if there's any other requests that you would have of exhibitors as they enter your ring this weekend?
What I plan on doing, and I judge certainly fast enough
Hmm.
that I intend to do all my own ribbons.
Okay.
Because the ring steward, I mean, I'm sure they'll be wearing rubber gloves because they're going to be touching a lot of stuff from a lot of people.
Right.
So, and I'm not so hyper about catching the virus. I mean, it's possible. I'm not going to be stupid, but I just think by me being the only one, and I use hand sanitizer a lot, and the stuff I use in a closed environment, it will kill COVID for 24 hours.
Right.
After, you can put it on a surface,
Mm-hmm.
COVID, it can touch it and it won't live.
Mm-hmm.
It kills it immediately for up to 20. But that is in a closed environment.
Right.
Not with maybe ceiling fans or depending on whatever the show is. But
right.
I just think it's one more step to giving people confidence that not 20 different people touch the stuff that I'm handing to them. The same with any trophies I'll hand them myself. And, whatever I can do to make people, I think it's a mental thing. Some people just have a block for whatever reason. And the more we just advocate, and as I said, I have a firm belief that the people that are screaming the most are very well off financially, that want you to stay home, depending on the retirement, in which a lot of us are at that stage. It's easy to tell other people what to do. It's like me telling you to jump off a bridge, but I'm not going to do it.
Right, exactly. I mean, and you're right. I mean, but again, I think if we all maintain the you do you, I do me. I mean, if we're comfortable going, we go. I mean, I am comfortable going. Right. If I were here by myself, I would be on my way to Oklahoma right now, but I'm not. So I'm not going to judge those who aren't, and I'm not going to judge those who are. I'm going to be jealous of those who are, but that's it. So,
but I don't want anyone to think that there's not a tremendous demand. I mean, I don't care if your show normally runs 600 dogs, and if you have room for 1,000, you better put a limit on it to 1,000.
Yep,
I mean,
absolutely.
Everybody that I've talked to, a couple of the local governors shut them down where they had intended to. The shows I was going to judge in Perry, the fairgrounds decided to not open the fairgrounds until a week after those shows. That's the only reason they were canceled.
Right.
So, this is a changing thing, but we need to go forward sooner or later. And I expected to see some spikes, especially with so much more testing.
Right.
And there's a lot of different thinking about the virus, but I also believe in the herd immunity. I think so many people have had that and didn't know it.
Yeah.
A lot of these tests are proving that out, because you just think, you had a rough cold for 2 days. It doesn't affect everyone the same way.
It doesn't. Absolutely.
And the more people that get it and get over it, the harder it is for it to spread.
Yep.
And I really think with what they're doing and their fast track and everything, I'll be shocked if we don't have a vaccination by late this fall.
Mm-hmm.
And I'm sure it might take the average person longer to get a vaccination, because they're going to give it to first responders and hospital people that are at risk, which I certainly think they should be.
Right.
Those are the people that are really jeopardizing their life every day.
Absolutely.
But I'm always think the glass is more than half full anyways, even if it's a quarter full. Indeed.
And I agree. All right, we'll take your 3/4 glass full and be safe as you go to Oklahoma. And I will see you soon, I'm sure. A little bit longer than I wanted to.
I look forward to it. It'll be great seeing you again.
And I thank you so much for today, and have fun in Oklahoma. Give everybody an elbow bump for me, would you?
Do it. You stay safe.
Okay, take care, Jim.
Bye-bye.
Bye. And that's Jim Moses for today. We will be back in touch with you soon with more folks that are heading to Oklahoma. Until next time.